Cooking is an essential part of Mexican culture. Tortillas, tamales, fajitas make up the traditional diet of many Mexicans. Unfortunately, cooking comes at a cost. Women are exposed to high levels of particulate matter from the biomass fuels they burn in order to prepare these meals. Some may find themselves with a bad cough, trouble breathing, and other lung irritation symptoms due to chronic long-term exposure to these particulates. COPD, or chronic pulmonary obstructive disease, can manifest as shortness of breath, persistent cough, wheezing, fatigue, and tiredness. Many Mexican women are finding themselves facing these detrimental health effects from using biomass fuels when cooking. Improved cook stove intervention programs could be the much-needed answer to reduce harmful exposures to biomass fuel. As part of the GIRA project, the Patsari Improved Cook Stove is leading the way in improved cook stove intervention programs in rural Mexican areas. However, adoption of these improved cook stoves is not 100%. Only about 50% of the women that have the opportunity to use the new cook stoves actually continue to use them. Difficulties with setup, maintenance, and use may prevent new users from adopting the cook stoves in their daily routines. Understanding what exactly may cause a user to adhere to one stove over the other could help programs such as the Patsari Cook Stove gain widespread user acceptance and increase the impact of the improved cook stove. To address this problem, a public health approach would be ideal. Stemming with education and training in human factors, environmental health studies, and occupational health backgrounds, graduate students from the Texas A&M School of Public Health are teaming up to find a solution. Particulate matter contributes to COPD. Using a particulate monitor, we can sample the air and collect data about how much smoke is being emitted from each cook stove. We can then analyze the samples to determine if these levels are harmful and what the cumulative effect of exposure to the particulates can have. Efficiency is also a very important factor when considering the benefits of one cook stove over the other. Using the adapted water boiling test and the controlled cook stove test, we can compare the use of the two stoves to see which one is more efficient in terms of water usage and fuel usage. Understanding user-centric criteria is a crucial part of making sure the stove will be adopted. We are asking users to tell us about their experience with setting up, maintaining, and using the stove to better understand the difficulties that may lead one to discontinue use of the stove. What we are finding is increased efficiency, lower smoke production, and overall user preference is influenced by a variety of different factors that the techniques and methods used in this project helped to identify. Knowing this information will help future implementers of the Patsari and other improved cook stoves develop better interventions that lead to decreased health effects in suffering populations in Mexico and other regions.